Hello everyone. I am Dr. Berk. I have previously prepared a video about this quintet treatment, which is the best treatment method for patients who benefit from medication in erectile dysfunction. I made it a little more animative. I would like to decorate it with animations and explain it again for better understanding. We also need to know what we are doing and how long we are applying it. Of course, hardening is not just a physical event, there are many social, cultural and psychological things. Hardening needs a warning in order to have a good hardening. Visual, physical, auditory and hormonal. For this reason, if a person has erectile dysfunction, they must be questioned. Then there has to be a nerve transmission. Muscles need to contract. Then there should be blood flow and the blood should not return as it came, that is, there should be no leakage, and as a result, there should be hardening. Of course, there are many questions to be asked in hardening. On the physiological side, the situation of the person with the partner, the situation with the spouse, the relationship with masturbation, the general social life, whether I have lost a relative or not, for example, whether there is a loss of a father or not, I am with his wife, I am a partner and I masturbate, these are also very important. Is there a suitable time, suitable environment? Is there a suitable person in the relationship? Is there any use of porn, for example? All this also needs to be asked. Of course, what kind of treatment do we do physically? First, we stimulate the nerve of the penis. There is a dorsal nerve above the penis. It's called TENS therapy. This stimulation increases intrapenile pressure. And sometimes there may be some glitches and errors in these penile nerve stimulations. Of course, it also offers us a solution for good. This is very important. That's what we're doing. The penis has muscles on the back. In other words, there is already a muscle group in the penis itself, smooth muscle. It's not something we can interfere with too much. But just above the anus of the penis, there is a striated muscle group. They both provide ejaculation as good muscles and contribute to hardening. In particular, it is important to strengthen these muscles, to give electrical stimulation to these muscles, and also, of course, to exercise physically. We also stimulate muscles by exercising. We do shock wave therapy to the penis. Magnetic. What is it for? To increase the blood flow to the penis, to expand the penile vessels if there is a spasm, to create new small calcific vessels. Therefore, the more blood flows, the more stiffness the better. The same thing happens with the part of the penis that is visible in the front, as well as in the back in the lower part towards the anus. We do ultrasonics there as well. The previous one was magnetic, this one is ultrasonic. We are trying to increase blood flow by giving shock waves to this area in the same way with ultrasonic currents. And we do PRP. PRP treatment is an important treatment. We take the person's own blood and activate the cells and healing cells there into the penis and then re-inject them into the penis. Of course, under normal conditions, it is absolutely necessary to activate it. Because blood is already passing through there, those cells are passing, but they are not active because there is no wound, cut, or anything because they are not active. We take them out, trick them outside, activate them and inject them back into the penis. You can think of it as a mini repair. In other words, if there are some malfunctions in the muscles, nerves and vessels, it can eliminate them. You can roughly think of it as a mini repair. That's what we're doing. And finally, vacuum therapy. I made a video about it. Why is it used in erectile dysfunction, etc. I'm not going to talk too much about it here, but even when vacuum is used alone, it contributes to erectile dysfunction. Of course, we are currently using them in addition to these. The main treatment here is shock wave therapy. Doing vacuum, TENS, EMS, PRP makes the job 30% better. That's why this 5-way treatment and even the 6-way treatment with vacuum is very important. How do we do them? In the form of a cure, we meet 2 times a week, 6 sessions for 3 weeks, a total of 6 times. Here's what happens. Monday can be Thursday, Tuesday can be Friday, Wednesday can be Saturday, it doesn't matter. We meet every 2 to 3 days. We do PRP in the first sessions of the first week, the second week and the third week. In other words, we do 3 PRPs. We do the others 6 times. We give the vacuum to the people. We teach the vacuum device. We treat for 10 minutes, 20 minutes a day according to the condition of the person. That's our treatment plan. This goes on for 3 weeks in a row. Once we have done this, when we check the results, after a month, So we did it for 3 weeks, we are waiting for another 4 to 5 weeks, we see the result. If the situation is good, patients continue in this way. Generally, this treatment can be effective for more than 5 years in people who do not have diabetes, blood pressure, serious heart problems or do not have any problems related to a social life, and who have not suffered sudden traumas. However, if there are uncontrolled conditions such as diabetes and blood pressure, it is the best solution to repeat it every 2 to 3 years. Thank you.